Welcome to Channel 17, the Town of Colonie Government Channel.
Hello everybody, and welcome to the Senior Resources Show. My name is Cary, and I'm the Director of the Town of Colonie Senior Resources Department. Thank you for joining me today. I'm very pleased today to have two guests on my show. Our guests are from the Stratton VA Medical Center. I'd like to welcome Robert Pecker, Assistant Manager of Veterans Service Center, Veterans Administration Medical Center, and Marianne Hunter, Caregiver Support Coordinator at Albany Veterans Administration. So welcome both of you to the show today.
Thank you.
Lots to cover. We only have a half hour, but I'd like to talk mostly today about the veterans services that Bob can talk on. And if we have some time, we'll spend some time on the caregiver support services, which are so important not only to the veterans, but to their families who are doing the caregiving and are supporting them. Okay, Bob, we have a lot to cover. Let's start with the VA healthcare services. What exactly are they, and who is entitled or could benefit from the VA healthcare services?
Well, any veteran who has an honorable discharge from active duty is eligible for VA care. Prior to September of 1980, no length of time was required, but after that date, one would have had to have 24 consecutive months of active duty service or be ordered by executive order to, such as a National Guard or a reservist, to be ordered to active duty. With regards to what are they eligible for, they're eligible for any kind of care that the VA offers once they are eligible as an honorably discharged veteran. There are exceptions to eligibility and care. The eligibility based on their service connection, which is a rated disability. They are also non-service connected veterans. Those are veterans who do not receive any money from the VA, but are eligible based on their service. Mm-hmm. The VA offers all kinds of care. The VA in Albany specifically has all disciplines of medicine, including especially women now. That is a new discipline that the VA as a whole has become more geared to because of all the women that have entered into service.
Sure. Now, when you talk about the graded level of care, can you talk a little bit about what that might mean so that our viewers understand? Is it a percentage of a service-connected disability that they might have would get them a percentage of care?
Yes. What happens is if a veteran is injured while in service, or there's a injury that was aggravated by service, then they can go to the Veterans Benefits Administration to put in for a claim. Based on that, they would go to have an exam seen by one of our physicians at our hospital or any VA, depending on where they are. And based on the injury, they are rated starting at 0% up to 100%, which can be given to 10% intervals. Mm-hmm. They are rated at 10% as, once they are 10% or more, then they can have all their care is free. They are also, they get money for that. Current rate for a 10% service-connected veteran is $123 a month, and that's all Congress mandated. Anybody above 10%, all the way up to 100%, is additionally, it's all free. They can get their medications free depending on their service-connected disability, or also depending on their financial assessment, which is done on a yearly basis as well.
Mm-hmm. Well, when you talk about the coordination of care, I've been very impressed before the show. I was telling you I'm a family caregiver of a veteran.
Yes.
We use the Veterans Hospital all the time. My uncle gets terrific care. And I'm very impressed with the way the disciplines work together and how coordinated the care is. Can you speak a little bit to that? As far as when a person first comes in and, like you said, they have that initial exam, how is it that a person is referred from, specialist to specialist? Is it done based through everything through a primary care physician, the way it would, if you're outside the VA service? Or
Yep, absolutely. Actually, once you come in and you enroll, your VA, first of all, VA care is portable, which means once you are enrolled, you can go to any VA medical center in the country. But as you were asking, once you get enrolled, then you have a primary care physician. Your primary care physician is your primary doctor who sees you for everything unless they are unable to take care of that. And then they refer within the VA. Mm-hmm. And as I spoke before, the VA in Albany has all disciplines of medicine, from plastic surgery to OB/GYN. Even though we don't have the actual OB/GYN part, we would refer out, but we do have gynecological services for women, and then anything else, behavior health, and pain management, orthopedics, all surgicals, all medicine disciplines.
Anything that a veteran or their families, in supporting them could certainly utilize. We'll talk a little bit about the family supports in a few minutes.
Absolutely.
But it's terrific because it is all coordinated, and I know just calling there yesterday how easy it is to access. Just calling in, you call into your team, you tell them what the issue is, and they make the appointment or connect you. So I think sometimes when people think of the VA hospital, they think of such a large entity, and it could be overwhelming. Normally, people see hospitals as where you go when you're sick or you have to be inpatient, but you really are like a large clinic in so many areas, so many disciplines that you're able to help folks with. Talk to me a little bit about where seniors can, or where veterans can go for care. I know they can go to the VA hospital, but I know that there's other places in the community.
Yes, our VA, the Stratton VA Medical Center, has 11 outreach clinics. They're called CBOCs, community-based outreach clinics. They go from all the way from Plattsburgh all the way down to Kingston. Mm-hmm. We have about a 150-mile radius north and about, 95, I think, to Kingston. And also east or west to Sydney, which is actually Bainbridge Clinic. And those are 11 CBOCs, which have primary care and also have behavior health services at every single one of those.
Gee, that's great, because that's really an underserved population. The behavioral health goes along with so many diagnoses that people have. So to be able to have that in each of your clinics really helps to serve the veteran much better. We talked a little bit about the cost associated with the VA healthcare system. Mm-hmm. Can you talk a little bit about, go into a little more detail about that, what it would cost a veteran to utilize your services? I mean, when we talk about what it costs for a senior today to have health care benefits and prescription drug coverage, it's very expensive.
Yep.
Talk a little bit about what the cost would be for someone utilizing the clinics, prescription drugs, and so forth.
Well, veterans have a copay of either $8 or $9 for medication, depending on their service-connected disabilities or whether they are non-service-connected as well. They are $8 for $8 or $9, as previously said, $15 for primary care visits, and $50 for specialty visits. This is all based on a yearly financial assessment, mostly for those non-service-connected veterans. Congress sets those thresholds based on the pension rate, a VA pension rate, or geographical income. There are 8 priority groups, one being the highest. Those who are rated 10% service-connected disability or more, their care is free, as I have said, but they would have to pay for that non-service-connected medicine. The most anybody would have to pay additionally, those who are in a pay status for their medication, would be only $960 a year total for medication, and that's where the $8 comes in. So if you go times 12, over a 12-month period, the $960 is the max, and after that, it's actually free. Mm-hmm. Anybody, like I said previously with that, is the service-connected disabilities all are free. The other co-pays are related to insurance. We can actually bill insurance for those veterans who have insurance. Mm-hmm. we can bill service-connected veterans for their non-service-connected conditions. Therefore, that's how the VA basically gets money back, so it, so it substantiates their...
Makes sense.
Yep.
Yeah, definitely utilize those
Yep.
other paying sources,
Yep.
absolutely.
That's what happens.
It allows you to enhance what you can provide
Yes.
through the VA healthcare system,
Mhm.
definitely. Can you just distinguish the difference between the Veterans Health Administration and the Veterans Benefits Administration? I know there's often confusion about what the hospital, the health benefits, and the benefits, the Health Association, the benefits are.
Sure.
I get that out right.
Yep, no, that's fine. Well, we have the VHA, Veterans Health Administration, which takes care of health, your medical needs, everything under that. The VBA, which is Veterans Benefits, is exactly that. It helps benefits. You can put in for claims. You can put in for, there's benefit booklets, there's disability compensation, life insurance, mortgages. These are all part of the VBA. Additionally, which fall, with both of those, fall under the Department of Veterans Affairs, you also have the National Cemetery Service, which additionally is another benefit. As an honorably discharged veteran, anybody who dies and is honorably discharged has the option to be buried in a national cemetery, as well as their wife.
I don't know if many veterans know that.
Right. So yes, and that's and it's also a big here now because of the Saratoga National Cemetery, which one is gorgeous.
It is beautiful.
And two, it's so easily accessible now. Previously, we had to go all the way to Long Island to bury our veterans.
I didn't realize that.
Yeah. So.
How long has the cemetery been in Saratoga now?
Ooh, I don't know. Over 10 years, I'm
Has-
sure.
yeah, time goes by so quickly.
And to be honest with you, I've never been up there. I feel bad about that because everybody keeps on telling me it's gorgeous, go up.
It is. Yeah. It's worth taking a ride on a
Right.
Sunday. I know
Right.
it's hard after working all week to when you take that hat off on Friday, you
Yep.
don't want to put it back on until Monday. A question that I have, and I don't know, Marianne, if this is more towards you, but I know it's a question that many of our seniors have, is if they're going to go to the clinic or the health care or to the hospital, is transportation provided at all? I know Colonie provides transportation to its seniors to get to the VA, but I'm just, wondering if, I don't know if that's something you can speak to, Bob?
I can speak to that. Transportation is available through DAV, which is Disabled American Veterans. We have county vans for every county that we service. They come either daily or several times a week, which is available by appointment to bring these veterans into their appointments from wherever. Like I said, even from 150 miles away, they bring them down on a daily basis. Additionally, it's called beneficiary travel. This is available to service-connected veterans or veterans below a certain income, and also based on their medical need, where the VA would actually provide transportation. And that's also available.
Yeah, and that's what's nice about the one-stop shopping approach to the VA healthcare system. If you're going to travel 150 miles to come to the hospital, you can take care of your hearing aids, your vision, see your primary care physician, do everything in a more condensed form and make one day of it instead of, as many of our seniors spend their retirement going from doctors to doctors. You can kind of do it in one consolidated trip, which is nice for seniors and veterans and their caregivers. Well, I think talking about veterans benefits, I'm sure there's so many questions that many of our viewers would have and that I have myself. So I think we'll make that a separate show and have someone here from the VA that can just talk about the benefits. I was to a training Marianne put on not too long ago, and I think that I know a fair amount about services out there for veterans and for seniors, and I learned so much. So I think we'll save more on veterans benefits for another show. But Marianne, while we have you here today,
sure.
I'd like to talk a little bit about caregiving services that are available. I was just reading this morning that 42.1 million family caregivers are in the United States, 42.1 million. They provide an estimated value of $450 billion a year in caregiving services. And that's up $75 billion from 2007. This data comes from AARP, a pretty credible source. So we know that our family caregivers are doing the brunt of the caregiving for not only our seniors but our veterans as well. And also, our loved ones that are not seniors. There's a lot of caregiving going out there, and we need to do our best to support our loved ones to be able to continue to do this hard work. Can you talk a little bit about some of the services that are available for caregivers? I know at the end of the show we will make all the information that you've brought available, how to reach you and how to reach the services provided through the hospital. But I was just, if you could just touch on
Sure.
how families hook up with your services and what types of services can you provide to support family caregivers?
Sure. The VA has always supported caregivers, and it has come around within the last year to be recognized much more strongly. As you were saying, some of the figures that have come out and some of the studies and research that have been done have really shown what we've all already known, how amazingly incredible caregivers are in supporting our veterans and our loved ones in the community, to remain in the community. Well, in 2010, President Obama signed legislation that actually went into effect this year in the form of a specific caregiver program at the VA, where there's one of me, a caregiver support coordinator, located at every VA across the country. There is now also a national VA caregiver support line. That's a toll-free number that people can call at any time and get information and assistance from a licensed clinician on the other line. And also there's a new VA website at www.caregiver.va.gov that's accessible and has wonderful information about caregivers. So that's one element of the caregiver program. But the services also that have been around for a long time at the VA for caregivers and for veterans, because supporting the caregiver is in effect supporting the veteran.
Absolutely.
Include things like respite programs, adult day health care programs, home health aid services, telehealth services. We have little health buddies, what we call them, that go in the home and can monitor certain conditions for people. We have home-based primary care services, almost like a traveling primary care. If somebody's homebound or has difficulty accessing medical care, this team would be involved and provide the medical care in the home. An offshoot of that is tailored care services. If somebody needs more short-term kind of assistance nursing-wise in the home to get back on their feet, then the tailored care program may be in order. Various programs within the VA regarding family support through our behavioral health clinic is available. Support and family education, SAFE programming is programming that's provided through our behavioral health clinic. And then I have a caregiver support group that I've started at the VA that's available in person. People can arrive and join me in person, or I'm doing it also on the telephone, because I realize that with caregiving, we don't always have a standard time frame that we can just leave the house and go do something. So it is available by phone as well.
That's great.
Yeah, and a lot of the phone calls that I get and the support that I provide is a lot of information, assistance in accessing resources that people might not be aware of, and providing support for long-term care planning, looking at advanced directives, and just regular support of how to get resources in place that can help someone not only caregive, but remain in the home and in the community as long as possible.
And, I ditto that with what we're doing in the town of Colonie, not only for supporting our veterans, but for seniors in the town. I'm always amazed with how hard we work to outreach the information on what's available, that folks can stay in their home. There are the supports to keep people in their home, not in a long-term care facility, are really underutilized in many areas. We talk about the adult day program. It's such a wonderful resource for caregivers, but I find often that is underutilized, and I don't know if it's the difficulty in getting their loved one there in the morning, getting them ready to get to daycare, or if it's the transportation, but it's such an important piece of respite for caregivers that I would like us to be able to use that more in the community to keep people at home. Do you find that it's a well-received program within the VA?
I think it's underutilized, and I think it could be, respite in general seems to be underutilized, but it is available. Every veteran has up to 30 days of respite per per year. It can be institutional respite or non-institutional respite. That's an important benefit, and a caregiver can really benefit from that time off, recharging the battery. Sometimes caregivers use that for scheduling their own medical care,
Right.
And taking care of themselves, and so that they know that they have their loved one is being well taken care of in respite. So that's a great resource. It's a great program, but it is underutilized. I'm hoping that the word can get out and people can become informed about it and ask the questions that they may have about it, and then be more likely to utilize the services.
Absolutely. So if a loved one was looking for some information on, say, the respite services, would their access into the program be to contact you?
They could contact me. I'm a point person for any caregiver question or any caregiver need. I also would, as you had mentioned earlier, all the services available at the VA stem from a primary care clinic, and the primary care clinic is a team of people. One of the professionals on the team is a social worker, so every clinic at the VA has a social worker assigned, and they can also be the gateway to a lot of these services for the veteran.
Oh, that's great to know. I mean, I'm just so glad that you both came on the show, because as we speak, I'm learning more things. And I think oftentimes services are underutilized because caregivers just don't know where that access point is. And there's so many access points in the VA system, it's making that first call.
That's right.
That I think is often a challenge for folks. I don't think they realize the plethora of services available to help support them, let alone take care of their veteran or their loved one. So that's great. Now, I know that there's a caregiver support group that goes on, that is held once a month?
Once a
at
month.
the VA, you did mention that. Are you finding that caregivers are attending this? Is transportation a barrier, or is there anything that we can do to help support this important program for you?
Getting the word out would be wonderful. People are attending. We have people by phone and in person. And we're taking different topics, informational topics about the VA, about caregiving, certain conditions. We're covering any area that a caregiver thinks that they might need support in. So it's an educational opportunity, but also a time for the caregivers who are present to share information, share their stories, get support, and leave there feeling that they've gotten something out of the time that they've spent. The original time frame for the meetings is 1 hour. It's the first Wednesday of every month from 12 to 1, but it actually runs over that. So it's actually been going for about an hour and a half, but people can come and go, and it's very open. It's a very open setting. We want to just outreach to people and be able to support them where they're at in their own situations.
And I find one of the greatest benefits of a support group is the friendships that the attendees make. They start to look forward to coming every month, because it's not just about the respite and learning about services. It's connecting with folks that you have something in common with. And I think many times we hear from caregivers, oh, it's just one more thing to do. But it sounds like you can help support them in getting care for their loved ones so that they can come and take advantage of the caregiver support group, or pick up the phone and be part of it that way.
That's true.
Yeah.
And it's fun. It can be, it's an outlet too. It's an outlet opportunity for people to have a little bit of fun as well.
I have to tell you, one of my uncle's favorite things about going to the VA is that little store down is it in the basement of the VA?
Yes.
That is always his favorite place to go after we finish with our medical appointments, and that's a really great service for the veterans to be able to go in there and get clothing or whatever items that they may need at very affordable prices, aspirins and Tylenol and things like that, which makes it very nice. It's again including a one-stop shopping approach to getting what you need to help supplement your health care.
It's true.
Yeah.
And I believe isn't what you can get in there tax-free?
Yes, everything is tax-free, and the canteen service, which is nice. you can save a lot of money on
Yeah.
when you don't have to pay that tax.
Yeah, absolutely. Little things that folks need, and they don't
Yeah.
have to make that trip on the way home. You know, it makes it nice for folks. Well, we've covered a lot of information. I know I did want to touch on an event that's coming up on September 17th before we finish.
Yes,
Do you want to
thank
speak
you.
a little bit about that, Marianne?
I do,
I
I
have
do.
the flyers, and we will post it after the program, at the end of the program as well.
Wonderful. Yes, it is an exciting event. It's the first time we've done something like this. It's a service member, veteran, and caregiver appreciation event, and we're holding this event at Silver Bay, which is on Lake George, and it's going to be held on September 17th from 9:30-ish to 4:30-ish. The time frames are whenever people can get there and how long they'd like to stay. But it's an opportunity. We're going to have speakers, information about the VA, about benefits, about anything to do with caregiving, a lot of resources available there, the community, and also there's going to be an opportunity to bring your family and have lunch with us, relax and refresh and enjoy yourself. It's a day really of appreciation of the service that our service members, veterans, and caregivers excuse me, provide on a daily basis and have provided for many, many years.
Oh, that sounds like a nice day, and it's rain or shine. So
Rain or
regardless
shine.
of the weather, it's going to be a go. Now, I know it's a free day. Is there any transportation available?
Yes.
I'm always
Yes.
worried about transportation.
Yes.
We can't get
That
folks
is a
out of their
topic.
homes unless we have transportation for them.
Yes, there actually is. We're going to have a transportation bus available from the VA. We'll take off from the VA that morning, and we'll drive to the Silver Bay Resort, and it will leave at some point in the afternoon and come back to the VA. So
isn't that
that's
great?
no charge. None of
Oh,
this
that's
is any
wonderful.
charge for a veteran or a service member or their caregiver.
Well, I urge all of our veterans out there and their loved ones to take advantage of this day. Now, if you want to register to attend this day, you have to call 518-626-7386. That's 6267-FUN, fun, which we're all about fun.
That's right.
So that's great. It sounds like a really nice day. And this is the first annual, so you hope to have this occur next year
We
as well?
sure do. It's a result of our Veteran Community Partnership initiative here in Albany. And we've got a bunch of agencies that are coming together and really promoting this and hoping that this takes off and can become a yearly event.
Oh, that's great. That's great. Well, we've used up just about all of our time. I want to thank you, Bob and Marianne, for coming today and for sharing so much information. We really just touched the surface on so many of the services that are available. But I think that we have, veterans and their loved ones, given them a taste of what they could benefit from the VA and how to access it. But I would like if one of you could just give the 800 phone number or the phone number where folks can call and make that initial call to get help. Mm-hmm. Do you know that number?
Well, you have, there's two numbers actually. I would call for Veterans Benefits Administration would be 1-800-827-1000. And that would go to the local VA regional office, which our regional office is the New York regional office. Additionally, for health care, you could call the Veterans Service Center at Albany to my office, which would be area code 518-626-6710. And that would be my extension, and I could help anyone who calls at any time.
Well, thank you. Thank you for sharing that information, and thanks for coming on today. I know your days are busy, and to take the time out to, educate the seniors in Colonie and the veterans on what's available is truly appreciated. Thank you again. Thank you for joining me today on the Senior Resources Show. I'm glad that you took the time out of your day to join me, and we'll see you next time. Thank you.